This is going to be just a short video about the scar tissue mobilization. I usually get asked this quite a lot, and I see quite a few patients which, when they come, they have some kind of like an old scar or maybe a recent scar. Nobody told them or they didn't do anything about it, so I would like to just address that. Why is it important? We have a lot of sensor, a lot of free nerve endings which transmit the pain. They can limit the motion, so any kind of restriction in sliding, gliding the skin can affect the movement by itself. It's not going to affect it mechanically, but it's going to cause a little bit of pain or a little bit of discomfort, and your body is basically going to move around it. So process is super simple. Usually what is recommended is two types. So one is C-bend. So let's say this is the scar. So this was the dash. I fell off the bike like a month ago and it was quite deep. I fortunately didn't need any stitches, but it was quite deep. It took like a month to get to this stage. So first one is a C-bend. So you're just going to, let's say, put two fingers over here, one over here. This is the scar, and you're just going to push across like this, holding it, respecting your pain level, of course. So let's say from 1 to 10 you shouldn't, or you wouldn't want to go above 5, and you can do the same from the other side, and you can kind of see or feel where is that scar or what direction is the most restricted. Where you feel the restriction or a little bit of pain or kind of like stinging sensation, you just hold it there a little bit and usually it's going to decrease. So this is the common one, so C-bend, and then you have S-bend. So this is the scar. You are just pushing the two fingers across like this, and again just holding, feeling which one is the most limited. You can see this one is still quite fresh. If there is some skin and it's closed, you shouldn't be worried too much. If there was some stitching, I would usually wait like 2-3 weeks till it heals up properly, maybe even after the stitch has been removed, and then you can slowly, gently start to mobilize it. What I usually then do is I assess the skin by itself. So let's say over here I'm able to lift the skin just fine. Over here it's a little bit harder, but I can still lift the skin, and where the scar is not so much. So again, I'll just work on it, lift it a little bit, and kind of go around like this. I already worked on this scar before I started the video, and also I got interrupted by my family once or twice, so it's quite visible now. It's actually lifting quite nicely. This doesn't need to be really long session. What it usually takes only like 3 to 5 minutes, and it can make a massive difference in what that scar feels, move, and so on. Before I started, it felt almost like a big bruise on the bone, and there is some bruising still on the tibia, on the periosteum. I was actually surprised I didn't break the bone when I fell, but the big chunk of that lump, or big part of that lump, was basically just a tissue which was kind of like just bunched together over there. So by this you're going to improve the sliding and gliding of the skin side to side, its ability to stretch, to take a little bit of load across. Again, just explore a lot of different direction, but again, it shouldn't be stuck, it shouldn't be painful to move. If it is painful to move, it's going to, especially over the time, it can cause quite a big trouble. So we can see all the time, like let's say after the appendix or after the back surgery, a lot of sensation, a lot of pain can be caused just by the simple scar tissue. So, and again, like 5 minutes, it's low-hanging fruit, so why not do it? Guys, take it easy, don't fall off the bike like me, and hopefully this was helpful.